You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thank you for listening to American Medicine Today. I'm Kimberly Brumell, joined by our radio executive producer, Ethan Euchre.
Always fun to be here.
It is.
Especially on a holiday weekend.
It is a special Labor Day edition of American Medicine Today. On today's show, we're going to speak with maternal health expert, Dr. Shoshana Bennett, about a certain condition which affects new mothers, and it's much more common than you would think. Not only that, but it also affects the men in their lives.
Yeah, which I didn't know. That was total news to me.
Yeah.
So we'll get into that a little bit later.
It's a lot of things that have been in the headlines, too. Then we're going to hear from forensic scientist Judy Melnick, whose new book, Working Stiff, chronicles her intense rookie season as a forensic pathologist in New York City.
Yeah, you know, people love those, the CSIs, the NCIS, those kind of shows,
Right.
but a lot of it does parallel reality, but a lot
Correct.
of it is nowhere near the reality of the situation. And also what's interesting about Judy's story is that she was in her, as we say, rookie season,
Yes.
2 months into working in New York City when 9/11 happened.
Yeah, that's tough.
Yeah, so we'll get into that. It's a pretty good story.
And later we'll be joined by award-winning journalist Steve Silberman about his new book, which turns the conventional thinking about autism on its head. And then in the final segment, which is for our affiliates, we'll also hear from author and a scientist who has written a strange and fascinating book about brain disorders, most of which you've probably heard of. But up first...
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
Well, it is my pleasure to introduce Monica Lemoyne from Louisiana. She is on the line with us, so welcome to the program, Monica.
Hi, thank you.
Hi. Now, you have an amazing story to tell, so why don't you tell us what caused your initial pain? Were you in an accident? Was it something degenerative in nature?
It was a motor vehicle accident whenever I was approximately 21 years old,
Okay.
and I was thrown through the windshield, went to the emergency room, and of course they did x-rays and told me that my neck was not fractured.
Okay.
But they told me from the nature of my injuries that I would have pain pretty much for the rest of my life.
All right.
And in the last 3 years, the pain had gotten progressively worse.
Right.
So I knew something other than the ordinary was going on. So I sought an appointment with my regular physician.
Okay.
And at that point, he told me my neck was fractured. My entire cervical vertebrae was fractured.
No, wait, Monica,
Oh, my
now hang
goodness.
on. How long after the accident did you live with that before someone actually said your neck is fractured? How long did you walk around with a fractured neck?
From the age of 20 to the age of 40.
20 years.
20
You had a fractured neck, and no one diagnosed that.
Unbelievable.
That's incredible.
Correct.
Can you explain the pain? Because I'm sure there's people listening that have problems just like you did. Can you explain what that was like when you experienced the pain? Was it localized, more shooting, throbbing?
It began as a lot of neck pain. It felt like, I'm sure most everybody can relate to what you call a crick in your neck when you slept crooked, and it's just very tender and stiff and just achy.
All right.
But it wasn't.
And-
Go ahead.
I'm sorry.
But it wasn't like super severe pain that, like nerve pain, pinched nerve type of pain. They usually describe as it's a shooting pain, or yours was just more of a constant sort of throbbing type pain.
In the beginning,
Okay.
it progressively got worse, where it did involve my right arm and my first 3 fingers. There was a shooting pain. Then it became intermittently numb,
Okay.
and then eventually went to permanently numb.
Ooh.
Wow.
And that's when I sought Dr. Bonati's Institute.
Let me stop you for a second, though, Monica. When you talk about that pain going, shooting down your arm and into your fingers, how is that affecting you at work?
Well, I'm a nurse, and at the time I was working on a hospice unit where I was having to give a lot of IV push medication.
Okay.
And all of you nurses out there know that your first 2 fingers and your thumb is your main tool when you're given IV push medication. And I could not feel anything in those first 2 fingers and my thumb. So I was having to watch my fingers rather than feel what I was doing. And I was very clumsy as far as holding things. I would drop a lot of things. So it was affecting me at work.
Okay.
And now, was this both hands or just the one hand?
Just the right hand.
Just the right hand.
So it was not only affecting you at work, but it was causing trouble with your grip. Did it affect you when you slept?
The pain was actually worse when I slept. You would think at night you get to relax and lay down and,
Right.
Just relax from the day. And it didn't happen with the type of neck pain that I had. The more comfortable and relaxed that I got, the more stiff and the more muscle cramps that I got in my neck and my right shoulder and my right arm.
Okay. Now, you said it progressively got worse in the last few years. How did you find out about the Bonati Spine Institute?
Luckily, I had friends that had had surgery at the Bonati Institute and with similar neck problems as my own.
Okay.
And had wonderful results. So immediately, whenever I started describing the problems that I was having with my neck, they said, "Oh, you need to call this place."
Mm-hmm.
And so you had, I just want to back up for a quick second. You had seen previous doctors before finding Bonati, right? And what did they tell you they thought needed to be done to fix your neck pain?
Well, when I saw my regular physician, I had already tried physical therapy previously, just as being a nurse, and my doctor recommended some things to do. He offered to do an injection in my neck, which I declined.
Okay.
And then the next step, they were recommending a neck fusion surgery. And I knew I did not want to do that.
Right.
Yeah, that's kind of what I wanted to get at because that's what happens. Luckily for you, you were smart enough to know that's not what you wanted. Usually, a lot of the patients that we talk to, they don't know any better, so they say, okay, well, you're the expert. You suggest I get a fusion done. Let's do it.
Yeah.
And then it either fails or
causes more problems.
Causes even more problems, and that's oftentimes how people find Bonati. So lucky for you, you skipped that step and found Bonati
Exactly.
found Dr. Bonati directly. So what happened after you reached out to the Institute?
I'm sorry, what happened after what?
After you first reached out to the Bonati Institute?
Well, it was initially, I sought out online. There was a questionnaire to fill out. I did that, and immediately someone contacted me back and suggested that I send my MRI disc in so that they could take a look at everything and make sure that it was within their expertise.
Sure.
For the surgery, I mailed those off, and immediately someone called me back as they had received them and taken a look at them, and they said, yes, we can help you.
Okay.
So the next thing was to make an appointment to go to Florida and actually have them look at me.
Sure. What was that experience like when you walked through the doors at the Institute?
When we walked through the doors, Paul was the first person that we met, and he knew who we were, where we were from, my job, how many children I had. He knew my entire story already. So they already knew what I needed and what I was looking for.
Right.
Which made me feel comfortable right at first.
Okay.
It wasn't just a doctor's office where I was a diagnosis or a disease, but I was a person with real feelings and real pain, and they honestly wanted to improve my life, to make it better for me.
What was the evaluation process? They came in, they saw you, you spoke with the doctor. Can you describe what that was like?
I repeated my MRI results there because obviously our equipment here is a little bit behind.
Right.
So once they had a little bit better image, they put the images up on the screen for Dr. Bonati to look at. And he walked in, looked at the films, and walked over to me, introduced himself, and he said, you have pain in your neck, your shoulder, your arm that runs down your arm into your thumb and your first two fingers. I'm not sure which side. You can tell me which side, but that's what I'm seeing from the damage I see on your film.
And what were you
thinking? Did that amaze you?
I was blown away. He knew exactly what my problems were without me having to describe it to him at all.
Right.
That happens a lot, and I can imagine how you got to be sitting there thinking, how does this guy know? I didn't even tell him yet. So,
and he wasn't afraid. He wasn't afraid to tell you that you did need surgery, unlike some of the other places that you had gone to in previous years.
No, he wasn't afraid to tell me at all. He knew exactly where my problems were, and he knew exactly how he could make it better.
Why don't we fast forward to when you actually were on the surgical table? Of course, you knew that you'd be awake. You'd have what's called conscious IV sedation, but you're interactive with the doctor. Why don't you explain that?
Well, I was laying face down on a stretcher, and there was a position for my face to be comfortable.
Sure.
There was a TV monitor underneath the gurney where I could watch everything that they were doing.
Mm-hmm. Did you?
And during the procedure, as Dr. Bonatti would shave some of the bone, he would ask me, how does this feel? Is the pain better or worse? Can you feel this? Do you feel pressure? Tell me, describe it to me.
Mm-hmm.
And he said, when I get to a point where the pain is gone, I need you to let me know.
Right.
And it was maybe within 10 minutes from the beginning of the procedure, I was pain-free.
Wow.
So right there on the table, you immediately felt relief of your pain that has plagued you for decades.
Right.
That's incredible. So how quick was recovery? We're almost out of time, Monica, not to rush you along, but what was your recovery time like? How quickly were you back to work, and how do you feel today?
Recovery time was super simple. Of course, my nerves and my muscles and everything were a little tired from the surgery. It took about 2 days, but I was back at my normal activity.
Wow.
Unfortunately, being a nurse where I have to lift on folks, I could not return to full lifting for 6 weeks.
Right.
But I was able to drive within a week.
Wow.
That's great.
And how are you feeling today? Still pain-free?
Absolutely wonderful, pain-free.
Excellent.
Well, thank you very much, Monica, for sharing your story with us. I always find it amazing that people find out about the Bonatti Spine Institute from across the country and, even throughout the world. People travel to seek out Dr. Bonatti and the Bonatti Spine Institute in Hudson, Florida.
That's right. All right. Well, thank you for joining us, Monica.
Inviting me.
You're welcome.
Thank
Continued
you for
good
inviting
health.
me, and thank you, Dr. Bonatti, for all that you do.
Absolutely. We'll pass that along. Normally he's here with us, but it's a holiday weekend. But we appreciate you joining us.
Thank you.
Thanks,
All right,
Monica.
Thank you.
Yeah,
Bye-bye.
bye-bye.
That's one of the amazing things about the Bonatti Spine Institute and the patented exclusive Bonatti Spine procedures. They are targeted for each individual person, and they have pinpoint accuracy. They have 98.75% patient-reported success. So if you've heard nothing can be done, or you're always going to live on pain meds, or they have to slit you down the front and the back, not true. Seek out Bonatti at Bonatti.com or 855-267-0483. Well, coming up after the break, we're going to speak to Dr. Shosh, also known as Dr. Shoshana Bennett, about a certain condition which affects new mothers and is much more common than you would think. Make sure you stay tuned. You're listening to American Medicine Today. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti Spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonatti Spine Institute, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD. Once again, here are Dr. Bonatti and your host, Kimberly Brumell.
Thank you for joining us for American Medicine Today. I'm Kimberly Brumell, joined by our radio executive producer, Ethan Euchre.
Always glad to be here.
Well, we have an exciting segment. We're here with Dr. Shoshana Bennett, a.k.a. Dr. Shosh, or Shosh. Shosh. A clinical psychologist, a maternal health expert, and author of Postpartum for Dummies. Now, she's here to shed light on the most common complication of childbirth. So thank you for joining us, Dr. Shosh.
Oh, thanks for inviting me. Such an important topic. Thank you for doing it.
Here's my first question. I know you say the statistic that was in your book is 1.3 million expectant and new mothers this year alone will experience depression from postpartum. Now, forgive me if I'm wrong, but every parent I've ever known, they always say, it's the greatest gift I've ever been given. You know, I've never really seen the effects of this. You just kind of hear about it.
Right. And that's in the U.S. alone, by the way, that statistic. So this is happening wherever women are having babies. But yes, certainly, you know, when women are experiencing anything other than complete elation, right, there's a tremendous amount of shame and guilt and feelings of inadequacy, and that's often why women don't come forward. So, you know, let's face it, even when there's no depression or anxiety, this is boot camp, you know, right? When a baby first comes home, there's a lot of work.
It's true.
We hope there's some joy in there and that somebody isn't affected with an anxiety or a depressive disorder. But yes, it's very, very common. Baby blues is normal. Baby blues is mild stuff, you know, mild ups and downs and emotionality, but it should be gone by about 2 weeks after delivery.
Okay. What is the difference between just baby blues and full-on postpartum depression?
Well, that's one of the differences, the duration of the symptoms. So if it's mild, bluesy stuff, but it really should be gone by 2 weeks or at the outset 3 weeks following delivery. But if the severity of the symptoms, even if it happens immediately, like overlapping the baby blues period, if the severity of the symptoms of anger, of low self-esteem, of inability to sleep at night when the baby sleeps, you know, some insomnia, appetite changes, if the severity of those symptoms get in the way of her daily functioning, she shouldn't wait. She should get help right away.
Well, one of the other statistics I saw in here, because as Ethan and I were discussing, he's like, oh, this is good because it affects women. And I said, but wait, it also affects the men that they're with, the fathers.
This was news to me as well.
And the rest of the families and friends, like you said in here, the community.
I'm glad you brought that up. This is not a woman's issue. This is a public health issue. I mean, it affects everyone. It affects marriages. It can certainly affect the children. Untreated maternal depression can definitely affect kids. I mean, the extended family, friends, group she belongs to, the workplace, everyone.
But what I found interesting is that it says it also affects 10% of new fathers, and that number soars to 50% if the woman herself is experiencing postpartum.
Yes, it certainly can. So 10%, sometimes I get calls from women who are saying, you know, I'm doing pretty well. I feel pretty much like me, but I'm really worried about my husband. So 10%. But if she is depressed, if the mom's depressed, then yes. his, it goes from 24 to 50% risk, just as you said. So if he has any kind of a history of mental illness himself, if he's been depressed in the past, certainly sleep deprivation can bring it on for either the mom or the dad.
Right.
So yeah, there are varying risk factors. Certainly, when the husband is depressed, it's not because of the shifting reproductive hormones, but there's certainly other factors involved.
Well, you hear from people that don't quite understand postpartum that, they're just doing this to get attention. They don't like the fact that the attention's turned from them carrying a baby to now the newborn. What do you think about that?
I think that's ignorance.
Okay.
I understand, why somebody might think that, but no, this is a very, very real illness. Postpartum depression is one of 6 perinatal mood and anxiety disorders. This is a brain disorder. So, and we can certainly measure it. We can't see it on an X-ray, like a broken arm, but we can definitely be screened. We can definitely diagnose it. We can definitely treat it. So the great news is we can get rid of it.
Good.
But the rest is really based on people, not knowing that this is a real thing.
And Dr. Shosh, like you mentioned briefly just now, that there's 6 different types of this perinatal disorders, including obsessive compulsive. There's a form of PTSD.
Yes.
And probably the most frightening and the one that we hear about most on the news is what? Postpartum psychosis. That's where the mother sometimes murders their babies.
Yeah.
And that's, when you hear those really scary reports of mom harming or even killing their babies, almost always it's a case of the mom not being in our reality at all. She's psychotic. And that is very, very different from postpartum depression. And often, it's mislabeled as a severe postpartum depression, and then all the women with postpartum depression kind of go in the closet going, well, I don't want to be associated with a mom who is going to harm her kids. So that's another barrier to treatment.
What are some of the things that we can do for those women? Are there medicines, supplements, anything they can take to combat those symptoms?
Are you talking about postpartum depression?
Yes.
Or any of the perinatal?
Any of them,
yes.
All the certainly there's medication that can be very helpful. There's alternative treatments as well. I mean, I'm a big believer in nutrition. Not that what we eat can take a psychosis away. So certainly it depends on what what you have, the severity of the symptoms, how long it's been going on. But definitely there's a basic plan of action for every mom. So in answer to your question, it's a big question. There's medication, alternative treatments. There's complementary treatment, so if she's on medication, she can also be doing other things as well. But I know, for instance, when women are depleted, when their brain chemistry is depleted due to lack of nutrients, it can make an enormous difference, no matter what she's suffering perinatally. So, for instance, women are told about folic acid and calcium and D3, but they're often not told about, for instance, omega-3 fish oil. And we have an enormous amount of data about preventing as well as treating prenatal and postpartum depression and anxiety with omega-3 fish oil.
Okay, so postpartum can be treated and those symptoms can go away. Now, for those that suffer with the psychosis, does that ever go away?
Absolutely. Every single one of these disorders is considered to be an acute disorder, not chronic.
Okay.
So you could absolutely expect 100% recovery. Yes.
Where could they go for help if they need it?
Well, certainly, I would be very happy to be a resource for them. And if they don't work with me directly, I have a list of an enormous list, actually, worldwide.
If they wanted to reach out to you, how do they do so?
DrShosh.com, DrShosh.com. You can reach me very, very easily. And many of us do teletherapy as well, or through Skype or other kinds of webcam. So, there's great help everywhere, and nobody should be suffering in silence. You absolutely deserve to be happy. Your family is rotating around you. There's no shame that should be associated with this at all. Come forward, get help, and go on with your happy life.
Very important subject, of course. Dr. Shoshana Bennett, a.k.a. Dr. Shosh, clinical psychologist, maternal health expert, author of Postpartum for Dummies. We appreciate you joining us on American Medicine Today.
Thank you very much.
Have a great day.
Take care.
You too.
Bye-bye.
You're listening to American Medicine Today. Make sure you stay tuned. After the break, we'll have more. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonatti Spine Institute, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD. Once again, here are Dr. Bonatti and your host, Kimberly Brumell.
Thank you for joining us for American Medicine Today. I'm Kimberly Brumell, joined by our radio executive producer, Ethan Euchre.
Always a pleasure to be here.
Yes, well, we're excited because we are here with Judy Melnick, forensic pathologist and author of The Working Stiff, 2 years, 262 bodies, and the making of a medical examiner. Now, I believe she co-wrote this with her husband, TJ Mitchell.
Correct.
And this fearless memoir takes readers behind the police tape and shows what life is like in this harrowing world of forensics. So thank you for joining us, Judy.
Thanks for inviting me.
Hey, Judy, first off, of course, I have to ask, what made you decide to get into such a macabre profession as forensics? And she's actually calling us from the morgue right now.
Oh.
So.
Well, from my office. It's adjacent to the morgue, but
Same thing.
I went into forensics because initially I was drawn to medicine because my father was a physician, and he inspired me to study medicine, and I was always in love with science in all of the human body. But I didn't know exactly what subspecialty I would want. I started off in surgery, and the second chapter of Working Stiff details my experience doing surgery, and even though I loved operating, the hours required of the residency training just exhausted me, and I was not happy doing that. So I switched to pathology because I had had some experience with that when I was a medical student, but it wasn't as exciting to me until I found forensics. Being able to wake up every day and open the paper and see what happened and then go into the morgue and get the real story, that was what was exciting for me.
Now, you say in here a medical examiner doesn't fall out of the womb all-knowing, and I think you're relating that more or less to how it's portrayed on TV.
Mm-hmm.
That is correct. I think that television shows, whether it is crime dramas such as CSI or NCIS,
or even reality-based shows like 48 Hours of Forensic Files, first of all, they give everybody the impression that all forensic pathologists do are homicides, suspicious deaths, and really those are only about 10% of what we do. Most of Working Stiff is meant to give the reader a better grasp of what we actually do, and the remaining 90% are things like accidents or suicides or even natural deaths that are unexpected, not necessarily anything violent or suspicious. So that's why it was important for me to write this, to give people a correct perspective of what things are really like.
Well, and a lot about the book apparently is sort of chronicling your first year, your rookie season, if you will, working in New York City, of all places to start out, with just the craziness that goes on up there. 2 months in to your new profession, and boom, 9/11 happens. I mean, that must have been, just describe that day for you and what that must have been like.
So 9/11 was obviously something none of us could have expected or predicted. I was just going into a routine day. I was actually supposed to be shadowing someone in the toxicology lab, I believe, that day. And I saw the first plane as it flew over my head before it hit the World Trade Center, and I didn't recognize what it was initially. It was only after the news reports came in a few minutes later that I realized I had seen the first plane. The experience of being at the medical examiner's office during such a time was overwhelming. I mean, it was overwhelming for everybody involved, including the experienced professionals I was working with, but all the more so for someone like me who had just started and only had 2 months of experience.
Right.
It was important for me to put that towards the end of the book, though, because I want people to understand that it's not a 9/11 book. It's a book about forensic pathology training. And clearly I couldn't ignore that part of my training, but you can't really wrap your head around the response to a multi-fatality incident without understanding what a pathologist does on a day-to-day basis.
Right. Well, I was going to say that had to be so hectic because you're one of 30 doctors that was tasked with identifying those victims. And like you said, the multitude of victims in the 9/11 attacks. I can only imagine what that was like for you.
And the complexity of the trauma involved, because we're dealing with explosion, we're dealing with blunt trauma, we're dealing with burns and thermal injuries and the collapse of the buildings. Many of the remains were not intact. So, it's harder to identify. And primarily the issue in that case was primarily that of identification.
Now, what do you say that the body never lies?
I don't say that. That's what Dr. Hirsch says. And it's a wonderful saying because it tells you that the dead body is really the one who's giving you the information. I mean, people say to me, oh, your job must be so much fun, your patients never complain, and they don't talk to you, and you don't have to deal with that. But ultimately, my patients, when you're dealing with the deceased individuals, they do talk to me, but they talk to me by showing me their wounds or their injuries or internally their natural disease. More importantly, they're not my only patients. I really answer to their families. Their families are the one who want to know what happened, and the public has a need to know when the death is a public death, when it's a violent death, because then it's a public health role that we're playing.
And Judy, I got to imagine you've seen so many insane, just strange things. Can you give us maybe some of the strangest ones or the most odd ones? And there's probably a lot of mystery involved in some of these too, where it's your job to figure out what happened to these people. Any good stories like that?
One of the cases in Working Stiff involves a drug user who had been found dangling out of a window and then collapsed. And when the first responders came to the scene, there was actually a fire in the residence, and one of the firefighters was attacked by another person with a knife. So then there was a question of, well, did this guy go out the window out of his own volition, or was he trying to escape a knife-wielding person? And he did have what looked like stab wounds on his arms. But then when we went back to the scene, we discovered that there were also big shards of glass through that window. And with further investigation, we found out that he basically escaped out of his own volition. It was an accidental death, essentially, not a suicide. He was escaping the fire, and it was not a homicide.
Which obviously saved the guy that they took in from going to prison for life for murder, and you are the one that kept him from going to jail through your training.
that's the important thing. Those are the cases you don't hear about. You hear about the cases in the news when we do call them homicides, but there are just as many where there's suspicion cast upon someone. Either a child has died and the parents are being held, or there is somebody who's found in, their body is dumped somewhere, and everybody wants to think that it's something insidious or suspicious. But then when we do the autopsy, we find out that it's an overdose or it's a natural death. And sometimes people will try to dispose of bodies because they panic, but not necessarily because they've done anything wrong.
And I was also reading in your bio, Judy, that you were a consultant on some pretty high-profile legal cases. Any that we might know or our viewers and listeners might know of?
Well, right now, ever since the book's come out, I've been contacted repeatedly by the press anytime that there's an in-custody death, such as Michael Brown or Freddie Gray, and then most recently Sandra Bland, who apparently hanged herself in jail. The reason I'm getting contacted more than anything is because often medical examiners and coroner's offices don't have a public relations staff or don't feel comfortable talking to the press. And because I've had experience not only speaking to the press about my book, but just being able to explain the complicated medicine in simple words that people can understand without dumbing it down, that gives me an opportunity to really be a spokesperson for my field and hopefully draw more students into it, because that was my intention in the first place, is to get more students to study forensic pathology.
And what is your takeaway from some of these cases, especially being such big, current cases as a Freddie Brown? What are your thoughts on some of these cases against the police?
I think that the most difficult thing for us as forensic pathologists is that we get lumped in with the police or with the district attorney as being part of a government system that's somehow corrupt or trying to cover things up. And for speaking for myself and for my colleagues, we're scientists, we're doctors. I'm not in the business of covering up for criminals, whether they are regular criminals or whether those criminals happen to be cops. It's my job to objectively assess the evidence, collect the findings, and collect that evidence so it can be used in court. And when an autopsy is done by a medical examiner or a coroner, that first autopsy is the first independent autopsy, because that's when the evidence is collected. Any subsequent autopsy, if there's an expert who's paid by the family or by lawyers or by another agency to perform a second or third autopsy, that's not an independent autopsy. If the findings do not please the person who's paying them, they don't have to release those findings. The first autopsy, the one that's legally mandated, that's the independent one. And people need to understand that, because it gets consistently misinterpreted and spread in the press that somehow the first autopsy is biased, and that's not the case.
Do you get pushback, though, from the police that are trying to solve this case? Hurry up, there's a deadline to meet, we need the information quickly, or are you able to
take your time,
do what you need to do and then give them the information?
In any high-profile case, there's always pressure to try to get results as soon as possible. But it's important to slow down and take your time and get all the information before you come to any conclusions. And I think most competent, board-certified forensic pathologists are going to take their time. The important thing is to communicate that to the public, that this is not something that can be done within 24 to 48 hours. This is something that's going to require investigation that can take weeks or even months. And that doesn't mean we're covering anything up. It just means that we're being thorough.
And we're just about out of time, Judy. What would you say is the biggest takeaway from your book? What is the biggest misconception about forensics and the life of a medical examiner that you want to impart to the public? Because we only know what we see on TV and CSI and things like that. What are the biggest misconceptions?
I think the biggest misconception is the assumption that somehow what I do is morbid, horrible, and macabre. People always ask me, what drew you to this field? It's so yucky. And really, anybody who works in death investigation, whether it's a death investigator or a forensic pathologist or even grief counselors who sometimes work with the bereaved, realize very quickly that by helping people understand death, they can actually appreciate life so much better. That when you read Working Stiff, it's not just about the dead bodies. It's about us. It's about the living. And it's actually a really life-affirming book and a life-affirming story.
Well, thank you for taking the time to share your insight with us. Judy Melnick, forensic pathologist and author of The Working Stiff, 2 years, 262 bodies, and the making of a medical examiner.
Thanks,
Take
Judy.
care.
Appreciate it.
Have a good one. I find it fascinating.
I do
Whether
too.
it's dark and macabre or not, hey, call me dark and macabre. I enjoyed it.
Well, I do too, and I've watched so many of those crime scene investigators, and it's always made me want that sort of job.
Mm-hmm. Very interesting
I just
stuff.
wonder if they think it through and it's as dramatic as they portray it.
Her website, by the way, is drworkingstiff.com.
Well, fun things we have on American Medicine today. Make sure you stay tuned. Coming up after the break, you'll hear more. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonatti Spine Institute, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD. Once again, here are Dr. Bonatti and your host, Kimberly Bermel.
Thank you for listening to American Medicine Today. I'm Kimberly Bermel, joined by our radio executive producer, Ethan Euchre.
Always glad to be here.
Now, we're excited because we're on the line with Steve Silberman, award-winning journalist and author of Neurotypes, The Legacy of Autism and the Future of Neurodiversity. This is a groundbreaking book that ends the conventional thinking about autism. And, well, he's here to discuss it with us. So thank you for joining us, Steve.
Hey, Kimberly. It's great to be here.
Hey, Steve, I know that when I was growing up, at least, it was almost unheard of, autism. I knew one family that had 2 young boys that had autism, and that was it. Those were the only people I knew that had autism. Nowadays, you fast forward 20 years, almost everyone knows someone, and including my own brother, who has a young boy that has autism. Why such a spike in cases of autism, Steve?
Yeah, that's exactly true. Well, the reason is that in the late 1980s and early 1990s, the criteria for diagnosis of autism were completely rewritten, because before that, too many kids and adults were completely left out of the ability to get a diagnosis. So a cognitive psychologist named Lorna Wing in England, who herself had a profoundly autistic daughter named Susie, broadened the criteria for diagnosis to reflect what she called the autism spectrum. Another reason why, I'm nearly a baby boomer, so I'm kind of an old guy. And, people my age don't remember seeing autistic kids around in public when we were young. And one of the main reasons for that is because psychiatrists insisted that the cause of autism was bad parenting and so-called refrigerator mothers, which was a terrible burden of shame and stigma to put on families. And children were actually recommended to go into institutions for the rest of their lives. So the profoundly impaired autistic children were put in institutions where, of course, they did not do well. And the sort of, geeky, eccentric kids just didn't have a label. So that is the main reason why there's been such a spike in autism diagnoses for the last 30 years or so. And that's one of the main things I write about in my book.
Well, it's just crazy because it says here in 1975, 1 in 5,000 kids were estimated to have autism. Now today, it's 1 in 68. So can you explain what the spectrum is and how much the severity ranges?
Yeah, sure. Autism is one of the most heterogeneous possible conditions. Autistic people are more different from each other than non-autistic people are, because the spectrum ranges from kids who can't use spoken language and may never be able to live independently to chatty adults who are experts in their field.
Okay.
So there is a very, very broad range of manifestations of autism, as we know now. But then we didn't. And in fact, even though those figures are often quoted, it seems terrifying. Like, wow, one in it was actually 3.5 in 10,000 in the 70s, and now it's 1 in 68. It seems terrifying, as if there's been a dramatic increase. But if you notice, the definition of autism has so radically changed. It's almost false to insist that they're the same condition, because actually it's the boundaries of the diagnosis are much broader now.
And another thing is that you touch upon in your book is Asperger's syndrome. A lot of us have heard about it. Who was Hans Asperger? And I noticed in some of the notes we have here, you mentioned that his quote-unquote little professors were targeted by the darkest social engineering experiment in human history. You got to explain. You got my attention on that one.
Oh, absolutely. Well, Hans Asperger was a guy who was working in Vienna in the 1930s, and he had a clinic that was really a wonderful place. It was sort of a combination clinic and school, so it wasn't just an office where parents would bring their kids for a couple of hours of observation and a diagnosis. It was a place where children lived, and Asperger and his colleagues actually lived with the children and observed them very intimately, and watched them as they play. Asperger would actually read poetry to the children and see how they responded. There was a nun at this school clinic named Sister Victorine Zach who had the kids dance to music in the morning and stuff. And so in a way it was a place that really anticipated many of the approaches towards teaching autistic kids now. However, there's a very unfortunate fact about the clinic, which is that in 1938, in 1938, when the Nazis marched into Vienna, they took over the University of Vienna, where Asperger and his colleagues were working, and so the Nazis actually began a secret extermination program against disabled children.
Wow.
That's
So
awful.
Asperger, in fact, had to protect his children from the Nazis. And so that's what I talk about in my book. It's never been talked about before in any book.
Unbelievable.
The details of the daily life in his clinic and the struggle that he had to save his children from the Nazis.
Wow. So is that person the child psychiatrist that tried to suppress autism awareness, or do I have that mixed up?
No,
Is
that was
somebody
Leo
else?
Kanner.
Okay.
Leo Kanner was an American child psychiatrist who worked at Johns Hopkins in Baltimore, also in the 1930s and 1940s. Leo Kanner went down in history as the primary discoverer of autism, but one of the sort of scoops in my book is that it was really who discovered autism as we now understand it. And Leo Kanner had actually hired one of Asperger's closest associates from Vienna, saved him from the Holocaust, and brought him over. And that guy, whose name was George Frankl, was the guy who examined Kanner's first 3 autistic patients.
Wow.
Just one quick question, because we're running out of time. What do you think about vaccines? Because a lot of people make that association. The vaccines are the ones that are causing autism.
I completely understand why parents make that association. We live in a very frightening world. Big Pharma is certainly capable of conducting such a conspiracy and cover-up on a grand scale.
Sure.
However, in this case, it's not happening. That is not why kids get autism. In truth, even parents who believe that vaccines cause autism need to read my book, because basically the vast increase in diagnoses that is so terrifying to parents, and that leads many parents to believe that there is some hidden factor like vaccines. I account for the huge rise in diagnoses by looking at the way that the diagnosis has been in recent years. So check it out, because even if you're convinced that vaccines cause autism, you need to know the historical discoveries that I made in this book.
Got it. Well, thank you for joining us, Steve Silberman, award-winning journalist and author of Neurotribes, The Legacy of Autism and the Future of Neurodiversity.
Thanks, Steve.
Thank you. Great to be here.
All right,
Take
have a
care.
good one. All right, good stuff.
Well, you're listening to American Medicine Today. If you or someone you know is suffering from neck, back, or sciatic pain, reach out to the Bonati Spine Institute, 855-267-0483, or visit Bonati.com. Well, that about wraps it up for this local Labor Day edition of American Medicine Today. Our affiliates, make sure you stay tuned. Check us out on Bloomberg both Saturdays and Sundays. Check your local listings. And here in Tampa, WFTS ABC 28, Saturdays at 7.
We have a good one coming up for our affiliates, for our Tampa friends. Enjoy your Labor Day weekend. And brain disorders, some crazy ones, neurological disorders and diseases we're going to talk about with a scientist and author for our affiliates when we return.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.